Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. So one of the ways we look to defeat anxiety, right, is to be okay with the worst case scenario. That's not always easy. It's easy for me to say. Right? It's not always easy to do. Do you think you could ever be, and nobody wants their car stolen, but do you think you could ever be comfortable with the idea that you may have to replace that car at some point?
I mean, it would be hard for sure to, as I said, to kind of get through that with my family. But I think my family will get past it. Like I said, we have good insurance. My husband has a really good job, so I feel like we would get past it eventually.
All right. So what you're describing there, as you talk about when you have recently good insurance, and,
Yeah.
Your husband works and you work. That's an adaptive response, right? So that's let's call that self-talk.
Okay.
That's a message that you give to yourself, that you say to yourself, that tends to reduce anxiety. It tends to go after what we call the automatic thought, which is the thought that comes up that leads to worry. So, for example, when I said to you, what would happen if your car was stolen? What was the first thought that came to your mind right at that moment?
That it would be awful, that we wouldn't be able to afford a new car, and we would have one car for my family.
All right, so it would be awful.
Yeah.
We'd only have one car for the whole family.
Yeah.
Couldn't afford to replace it.
Right.
So kind of, so those three thoughts right there in quick succession.
Right.
From hearing that, talking about the scenario where your car's stolen. And what emotions did you immediately notice when those thoughts were in your mind?
I noticed, sad, like feeling depressed, like this is awful. Also really angry, like that someone would do this to me, like who does that? That someone would take my car, that someone would do that kind of thing. So
sad and angry.
Yeah.
So moving back to that self-talk is designed to go after those thoughts, like the type of thoughts you just told me about, and to intervene before you have that reaction, the sadness and the anger. Right. At first, when you use the self-talk, it's not going to work really well. Right? It's something you have to keep applying over and over and over.
Okay.
But it will likely work a little, and it'll likely become more effective the longer you can challenge those thoughts.
Okay.
Right. So let's break those earlier thoughts down. The ones you talked about when I mentioned that your car could be stolen.
Okay.
Right. Specifically, one was you wouldn't be able to afford a replacement.
Yeah.
So I think you've already touched on this from what you said, but what could your self-talk be specifically for I can't afford to replace the car?
Well, I could say, not maybe, I could say maybe, well, with the help of insurance and, we have decent credit, that I could, even if I can't afford like a perfect replacement or whatever, that we would be able to afford another car.
All right, so the adaptive response there to that thought of we're not going to afford this could be, this is going to be inconvenient.
Yeah.
But it's likely that we would get insurance money to cover that. And we have good credit.
Yeah.
So, does that seem like a reasonable self-talk? Does that seem accurate?
Yeah, I think so. I think that's likely that would be the actual result.
Right. So, in terms of and we do this a lot in CBT, in terms of how much you believe a statement, right? So in terms of percent, how much do you believe right now that self-talk, that your insurance would cover the cost of replacing your car, and you have good credit so you could replace that car?
Like right now, I think that, I'm kind of calmed down and we're kind of working through it. Mm-hmm. I feel like I believe it, like I'm confident that that would happen. I think in the moment I might be not so sure. When my anxiety is a little bit higher, I think it would be harder to believe myself.
So in that moment with strong emotion and worry,
right,
you could say the thought, like you could say it to yourself, mm-hmm. but you're not going to believe it as much
as I would like when we're calmly working through like solutions.
Yeah. So now it seems to be working pretty well.
Yeah.
But you're concerned that it's not going to be quite as effective in the field, so to speak.
Right.